Struggling with hair loss and wondering if a hair transplant really works? Hair transplant surgery is one of the most effective and permanent solutions for restoring natural hair growth and confidence. In this video, we'll explain what a hair transplant is, how it works, which techniques are available today, and what kind of results you can realistically expect. We'll also help you understand who is a good candidate and how to choose a safe, specialized clinic for long-lasting outcomes. A hair transplant is a minimally invasive surgical procedure that restores hair by relocating your own healthy follicles from donor areas, typically the back and sides of the scalp, to areas affected by thinning or baldness. Since the transplanted follicles are genetically resistant to hair loss, they continue to grow permanently in their new location. This autologous approach makes hair transplantation a definitive solution for androgenetic alopecia. Hair transplantation is based on the principle of donor dominance. Follicles taken from resistant areas keep their characteristics even after being relocated. The procedure is performed under local anesthesia, ensuring comfort throughout. It involves two main phases. First, the careful extraction of follicular units containing 1 to 4 hairs. Second, the precise implantation of these grafts into thinning areas. Surgical skill is essential, as each graft must be placed at the correct angle, depth, and direction to achieve natural, balanced growth. Hair transplant cost in the UK typically ranges from €5,000 to €12,000 for a medium-sized treatment area. The final hair transplant price depends on several factors, including the extent of hair loss, the number of grafts required, the technique used, the duration of the procedure, and whether additional sessions are needed. Surgeons' experience, clinic standards, and location also play an important role. While lower-cost offers may appear attractive, they can compromise both medical quality and final results. Several techniques are used in modern hair loss treatment. FUE, or follicular unit extraction, is a minimally invasive method where individual follicles are extracted and implanted with virtually invisible scarring and faster recovery. DHI hair transplant represents a more advanced approach, using a special implanter pen that allows direct implantation with high precision and optimal graft survival. FUT, also known as the strip method, involves removing a small strip of scalp and is typically used for extensive hair loss requiring a large number of grafts in one session. Each technique has specific indications and should be chosen based on your anatomy and hair loss pattern. Hair loss affects men and women differently. Male pattern baldness usually causes a receding hairline and crown thinning, while female pattern baldness leads to diffuse thinning across the scalp. Because of this, surgical planning differs. Men often focus on hairline reconstruction, while women aim to increase density while preserving donor area aesthetics. Techniques like FUE and DHI are commonly preferred for female patients to avoid visible shaving. Hair transplant results develop gradually. After the procedure, an initial shedding phase called shock loss is completely normal within the first weeks. New growth typically begins around the 4th month, with visible improvement between 6 and 9 months. Final results usually appear between 12 and 18 months. Clinical studies show that over 85% of transplanted follicles successfully establish long-term growth, providing natural and permanent results. The best results are achieved in patients with stable hair loss, sufficient donor hair, good overall health, and realistic expectations. A proper medical assessment is essential to determine whether hair restoration is suitable and to design a personalized treatment plan that respects long-term balance rather than short-term density. Turkey is widely known for hair transplantation, but Albania has rapidly emerged as a high-quality alternative. At KEIT Clinic in Albania, hair transplants are performed by expert Italian surgeons using modern micro-FUE technique, supported by strict medical protocols. All-inclusive packages cover surgery, accommodation, airport transfers, and follow-ups both in clinic or online, offering transparency, safety, and excellent results without compromise. A hair transplant is more than a cosmetic procedure. It's a medical solution that requires experience, precision, and long-term planning. Choosing the right clinic and specialist makes all the difference. At KEIT Clinic, over 22,000 successful procedures and 11,000 verified patient reviews stand behind our expertise. If you're considering hair restoration, book your free consultation today at www.kate.al and take the first step toward permanent natural hair growth.